Hi, I'm Dr. Mike Mihailovich. I'm a licensed clinical psychologist whose focus is on children and adolescents, specifically children and adolescents who struggle with developmental delays, including autism spectrum disorder. When parents have concerns about the development of their children, whether it's they're not engaging as they normally would, maybe they're not responding to them, or maybe they're not talking when parents think they should be, they go to their pediatrician because their pediatrician is their most trusted resource when it comes to their child. When visiting the pediatrician will ask them some questions, maybe even have them complete some paperwork or questionnaires. When it's all said and done, the pediatrician might recommend an evaluation that would help determine, does the child have autism spectrum disorder or not?
Other than a pediatric visit, another option is to come directly to Caravel and speak with one of our doctors. Either way, the purpose is to address parents' concerns about their child and receive an evaluation if appropriate.
Psychological services at Caravel involves two main aspects. The first, and most important, is the initial front-end diagnosis of autism spectrum disorder. Next is interventions such as individual psychotherapy and family support. The interventions that we provide are geared specifically around the diagnosis of autism, and providers are trained on strategies and techniques that will best serve individuals dealing with this diagnosis. The research is very clear that early intervention leads to best outcomes. You can't access early intervention unless you have early diagnosis. It is important that if there is any concerns in regards to a child's development, that these concerns are raised with the pediatrician as soon as possible. The pediatrician will then be able to guide you as the child's parent to appropriate diagnostic resources. If we can make an early diagnosis, we can set the path to early intervention, which, as the research says, leads to best prognosis. The first step in the diagnostic process is a diagnostic interview with a master's level clinician or the doctor conducting the evaluation. The doctor is going to ask a lot of questions specifically related to the child's development and behavior. Questions will revolve around early developmental milestones, as well as maybe some sensory issues or language problems. They're going to be specifically focused on communication of the child. From there would be an assessment. An assessment involves coming into the office and either working with the doctor directly or a paraprofessional. This paraprofessional is called a psychometrist. And the psychometrist has specific education and training in regards to psychological testing. In the office, we're not making the child sit down with paper and pencil because they're a child. Children play. And so we have a lot of toys and different interactions that we engage in to assess the child. We have bubbles, Play-Doh, dolls, balls, all of which is specifically designed to give us good information about what the child is capable of. At the end of all of it, there's a feedback session with the doctor. The doctor talks through all of the information gained through the assessment in conjunction with the diagnostic interview. The doctor is able to provide a clear diagnosis as well as specific treatment recommendations that will ultimately lead the child on a path of growth. We can conduct diagnostic evaluations one of two ways. The first is by bringing the child into the office. We do this approximately 30 to 40% of the time, and when required, by a child's insurance company. The majority of the time, we are able to conduct our evaluations via telehealth. This differs in that everything can happen within a 2-hour time window. The doctor is able to conduct their diagnostic interview. They can make specific observations of the child with the parent providing assistance in those observations. And then the doctor can give feedback in regards to the diagnosis and recommendations based on the observations of the child and the interview that occurs. After all of that, there is going to be a very comprehensive report. These reports can range anywhere from 10 to 20 pages in length because they contain a lot of data about the child. What's important about these reports is that they can help open doors to vital interventions that will help the child progress in regards to their development. Hearing the word autism is a very scary thing for parents. It means your child is different than other children. doesn't have to be scary. It can be the start of something much more positive, because hearing the word will lead to getting intervention, getting support, which ultimately will lead to positive outcomes for your child.